All right, Dr. Emer, we are live.
Hey you guys, it's Dr. Emer, and this really is Filler Friday because we are now filling hip dips and upper kind of buttock area with what I call the Bellalift procedure. This is Sculptra mixed with Bellafill. And a lot of people know I use Bellafill for acne scars, but also for other things such as buttock augmentation, cellulite. We do it for penile augmentation. We do it for a lot of things where we want a permanent change. The risk to a permanent filler, though, is the fact that you can get lumps and bumps or just be unhappy with the result. But in this case, this area in my thinner patient tends to really need more volume. And if we don't do something that's going to build long term, she's just not going to see her results. And so we're using a combination of Sculptra plus Bellafill. Sculptra is PLLA. Been using it for 15 years, originally for HIV patients for building volume in patients' faces. But in this instance, we're doing it for buttock augmentation and for hip dip. And a lot of people are doing other fillers as well that metabolize, unfortunately. In this case, we're doing it to build out some volume that's going to be more long lasting. It's always going to look a little strange at first. It's going to go down and kind of blend in and build collagen. Always have to do a little blending, so even though the sort of upper area is not her concern, you have to blend it a little bit, otherwise it just won't look natural. And it sometimes takes a few treatments. This is going to be the starting point for her to building. So you guys can look up that Bellalift. I've had a lot of patients that have done this before. The real only negative to this is financial, because it's more expensive to do fillers like this than it is to use your own fat. The thing is sometimes people don't have enough fat to use.
All right, doctor, people are asking, is our patient awake? Yes, guys, our patient is awake. We just numb them topically for this.
And there's numbing inside this as well, so it does burn at first, but then it's pretty reasonable. So again, I'm contouring out. I'm actually going to come over there for a second, you guys.
No, doctor, they're asking our patients in a lot of pain from this.
No, most patients honestly don't get much pain from this. And there is injections that can cause bruising.
What is the name of this procedure?
So we call this Bellalift because we're using Bellafill plus Sculptra. And again, I'm focusing it really on this outer sort of hip dip area where it rounds the buttock and gives a more curve to the hip. And so that's why what I'm doing is I'm kind of shaping it a little bit. I'm not just putting it in one spot. I'm blending it in layers here so that she gets kind of lifting throughout. And again, the idea is to have what we call an S-curve or an hourglass look. And to do that, you really have to kind of build this out. Not only
Someone wants to know about using a cannula for this.
So that was what we just talked about. You can't, I literally just said that. You can use a cannula, but I find that it's a lot harder to really get the shaping that you want, especially in this instance where we really have to kind of blend. I mean, we're building out lateral parts of her leg and buttock, and we really need that to all blend. And you guys can see here that she already has good projection. We're just trying to give her some curve. And the Sculptra will kind of disappear and kind of build over the next few months.
All right, so I want to know, why not fat grafting, guys? We did do fat grafting yesterday. In some cases, our patients do not have enough fat to get the results they want. So for this, we are using Sculptra plus Bellafill for the Bellalift, which is going to fill in her hip dips, give her this shape that she did want.
Yeah, I trademarked Bellalift and Bellasculpt. Bellasculpt for face and Bellalift for body.
So it says, where's the cannula? That's really dangerous.
It's actually not dangerous at all. Oh my, I wonder if these are actually doctors or not. Because if they're doctors, I'm a little scared. I love you guys, but if you know anatomy, This is not dangerous at all.
So wants to know how much for this, guys. You need to get a consultation with us. You can do that at emeragecosmetics.com, or you can send us a DM with your full name, email, and phone number.
Yeah, I need to know, when is it 50%? When have you done half exactly? I need to know. You have to tell me because I need to stop at half. So that's what we're doing. Basically building out this spot, this area. How many more?
2 more.
Okay,
That's
cool.
not 2 more.
Squeeze your butt as hard as you can. Squeeze it. Okay, good. Perfect. Relax.
How much filler can you inject in one session?
That's a really good question. I've never really had a limitation on the amount of Sculptra or Bellafill that I've ever had to inject. To be honest, I think the limitation is financial than it is the amount. But even with fillers, I've done before 100 at a time. And it's not really as much the amount as it is. Most of the time though, you don't like to overdo it with these permanent ones. I tend to keep it 4 to 8 aside, or plus or minus with the Bellafill, and then build on it every couple months if you see the improvement starting. Good? Other side?
Yeah,
Okay, cool. So now you guys can see, if you look at the one side, I'm gonna switch.
You can see a significant difference there.
There's fluid there, obviously, but we filled out the dip itself. So now I'm gonna go on to the opposite side. Perfect. Again, little pinch. And again, the initial part you feel a little bit, she feels, because there's some pinch and some numbing inside. The numbing burns a little, but our goal is to be blending this. That's why I do little threads throughout. It's amazing, she doesn't even bleed, which is phenomenal. So again, we do little threads, and this is not dangerous at all because we are not going into muscle. We're staying in these superficial layers.
Someone asked you about celebs. Is this how the Kardashians got their look? Is what they want to know.
I cannot comment on who said what. I don't want anyone coming back to me. But many different people do fat grafting, and many different people do injections like this. I have clients of mine who come from all over just to do a few Sculptra a month or every few months on their buttock, just to get a little bit more perkiness. And people do it for different reasons, and it's not just to have the largest booty in town. Sometimes it's shaping and contouring. Sometimes it's enhancement. Sometimes it's cellulite. You never know.
Right? Does Dr. Emer have a workshop for filler injectors?
We do training actually. If you want training, I've done workshops before in New York. If you guys want training privately, email pj@jcmrmd.com. Would love to train. And you guys can see we're blending right now the edges.
How long does this last?
So this technically is permanent, the Bellafill that's in here. The Sculptra lasts about 3 years and has to be built over time. So this is the initial starting point. We'll see how much we get. I was just telling them a story of a patient of mine that has done 3 treatments of this in about 1.5 years, and actually has a full-size butt now when she had none before.
Okay, when will she start seeing results from the Sculptra?
6 to 12 weeks.
Anyways, from the Bellafill, we can already see a difference from side to side. We were able to see one earlier before we started the second, if you were here for that. Tanner wants to know if we numb the butt.
Yes. So Tanner actually wants this treatment done, and that's why he's on there right now watching, because he's been begging to get this done. All the guys, I had 2 people at the gym yesterday come up to me and ask me about it actually, while I was at the gym. So people want it. All right, bring your leg down now.
After 3 years, will it deflate?
No, it just, you lose some of that collagen production. But with the Bellafill, you're gonna get some more permanent improvement. So that's why we combine. So typically what I say is you do a couple treatments in a row,
Does
and then you maintain every
we
quarter.
have a doctor asking us some questions here?
Oh, yeah?
Does Dr. Emer mix local anesthetic with the filler, or does he do a nerve block?
We always do. That's what we said. Initially you feel it and then you don't because of the numbing that's inside. It's also on my Bellalift videos.
What is the best thing for someone who got stretch marks from a BBL?
We have to take a look because sometimes stretch marks are treated with laser. Sometimes they're actually treated with medical tattooing. Shawnee, our expert out there, she's an amazing medical tattoo artist that works for us. And sometimes it's just skincare. So we don't know. I'd have to see.
Someone said,
So
what is the name of this and how much does it cost? Guys, this is the Bellalift. This is the Bellalift with Sculptra and Bellafill, which is a permanent filler.
Good.
And to get a cost on this, everyone needs a different amount. To do that, you're going to get a consultation with us at emeragecosmetics.com. We can do a virtual or in-person consultation, or you can send us a DM with your full name, email, and phone number.
And some of them we're
So,
doing for her.
so does the injection area swell like a